Many men are told their testosterone is normal, yet they feel anything but normal. Energy is low, motivation is flat, body composition does not respond, confidence feels reduced. This disconnect creates confusion because the number looks acceptable, but the outcome does not match expectations. This happens because testosterone levels alone do not determine how the system behaves. Hormones only matter in the context of availability, signaling, and responsiveness. A normal blood value does not guarantee that testosterone is being effectively used at the tissue level. What matters is not just how much testosterone is present, but how much is accessible and how the body is responding to it. One of the most common reasons this occurs is binding. A significant portion of testosterone in the bloodstream is bound to proteins and unavailable for immediate use. In some men, binding increases as a protective response. Stress, inflammation, metabolic strain, and aging can all shift the balance toward conservation rather than expression. The number stays normal, but the effect is reduced. Another factor is signaling sensitivity. Hormones communicate through receptors, and receptors adapt. When the system has been under prolonged stress or overload, sensitivity can decrease. The same signal produces a weaker response. This is not a defect. It is adaptation. The body is adjusting output to match perceived capacity. This is why chasing higher numbers often disappoints. If availability and sensitivity are constrained, raising the total level does not restore function. The signal is present, but the system is not listening. Men then assume they need stronger interventions, when in reality the limiting factor lies elsewhere. This pattern also explains why symptoms often appear before numbers change. Fatigue, low drive, and resistance to change can develop while lab values remain within range. The system adjusts function first and numbers later. By the time testosterone levels fall outside normal ranges, the underlying constraints have often been present for years. Understanding this reframes what normal means. Normal ranges describe populations, not individuals. They do not account for context, history, or system state. Two men can sit within the same range and experience completely different realities. That difference is not psychological. It is physiological regulation. This is why interpretation matters more than reassurance. Being told that labs are normal does not explain why outcomes are poor. It only delays the correct questions. The important issue is not whether testosterone is normal on paper, but whether the hormonal system is functioning optimally for the individual. On this channel, the goal is to explain those mechanisms, to show why numbers alone mislead, and why understanding regulation provides clarity. Because normal testosterone does not always mean a normal system.